everyone. Welcome back to Restoring the Mosaic. Today, I'm going to be talking about gender affirming care. This is the standard of practice for care for those children and adolescents who may or may not have gender dysphoria, but claim that they are transgender, born in the wrong body. Well, let me go back and give you a little bit of information about gender dysphoria. Before I do that, though, I want just to say that much of the information I'm sharing with you today comes from a group called Rethink Identity and Medicine Ethics. They have some really good publication on their site. So gender dysphoria, just to remind you, is the condition of feeling one's emotional and psychological identity as male or female is opposite to one's biological sex. It doesn't compute. But just because your feelings are one way doesn't mean you can alter reality. The gender affirmation is not the answer to gender dysphoria. Euphemisms like gender affirming care and new catchphrases like eat the teats, yep, you got that one right, are attempts to disguise the permanent reality of young women who are destroying healthy breasts with double mastectomy surgeries. It's atrocious what's happening. There are devastating health consequences of transitioning that are rarely, if ever, explained to the children or their parents. So let's talk about some claims. Well, there's a claim that gender affirming care is proven safe and leads to better health outcomes, better mental health outcomes. But the fact is that gender affirming hormones and surgeries have not been proven safe nor effective in improving mental health. Public health authorities in the UK, Finland, and Sweden all conclude that there is insufficient evidence to support the claim that gender affirming care, such as we provide in Canada for these children, provides any mental health benefits for gender dysphoria. That should give us pause. The Swedish Health Authority states the risks of puberty suppressing treatment currently outweigh the possible benefits. So we are promoting a standard of care, as they call it, that actually is doing the very opposite from what they claim. It is not healthy, and the risks outweigh any possible benefit. Treatment, they said, should only be offered in exceptional cases, whereas in Canada, children are almost immediately placed on puberty blockers once they go to the doctor claiming that they are transgender. So there's another claim that the trans community makes, and the doctors who treat them make the same claim, that gender affirming care is medically necessary. Well, is this true? No. There are no studies that demonstrate that gender affirming care is medically necessary for gender dysphoric children. In fact, up until 15 years ago, there was no gender affirming care, and the care that was given these children was to help them face the reality of their biology. The vast majority of these children subsequently reverted back to their biological identity. Determining medical necessity requires an accurate diagnosis, and there's no reliable assessment methods. There just aren't. They haven't been found yet. A medical necessity also requires evidence that the treatment will benefit the patient. These treatments are of no benefit. No randomized control group or long-term comparative studies have been conducted to assess whether minors who undergo medical transition experience better long-term outcomes or less suicidality than other gender dysphoric children, minors, who do not undergo medical transition. You see, many actually don't go through with the transitioning. They believe that they have gender dysphoria, or they may present with gender dysphoria, but it resolves very quickly. Here's another claim. Gender affirming care is consistent with established medical standards of care. I kind of quoted this in the beginning, but here's the truth. There are currently no established medical standard of care for these children. The field of gender medicine lacks sufficiently high quality evidence for any kind of standard of care. And the key guidelines that are often referenced by researchers or medical personnel in support of gender affirming care come from the World Professional Association for Transgender Health, as well as the Endocrine Society's guidelines. And they expressly state that these guidelines are not standards of care, but rather flexible clinical guidelines that cannot guarantee any specific outcome. So there you go, flexible clinical guidelines. It's pretty inflexible in Canada. That is the only thing that we can offer. Gender affirming care is all that we can offer for those parents and for children, their children who come into our offices, whether it's the psychologist or counselor or doctor's office. We are required to offer only gender affirming care. And yet there is no proof. It is not a standard of care, and it's high risk with very little evidence, if any, of good outcome. These standard of care, as they say, are simply practice suggestions. It's not very healthy. The claim as well is that gender affirming care is life-saving and prevents suicide. Is that true? Well, studies that suggest increased rate of suicidality among transgender adolescents contain a lot of estimates based on methodologically flawed information and non-random surveys. So it's not the best research they're using. Not only that, causality is very unclear. What's causing the suicidality? Is it the gender dysphoria? There's no proof of that. There's no evidence that suicidality is caused by gender dysphoria or reduced by gender affirming care, such as hormones or surgery. Children with gender dysphoria actually present with multiple risk factors, including at-risk attachment, unresolved loss and trauma, family conflict, loss of family cohesion, and the exposure to multiple adverse child events during their childhood. The narrative of transition or suicide has been and is the real potential to increase the risk of suicide. I mean, I remember in our local high school that there was actually, it was almost like one suicide after another. And the children, the teens, were actually doing copycat suicide. You know, when you start telling someone that they have to transition or they'll kill themselves, that's a false message, number one. But it puts tremendous pressure on these vulnerable youth. And they begin to believe that suicide is inevitable. So do their parents, because that's what they're being told. And that the medical gender affirmation alone is going to prevent suicide. That's not true. The appropriate response to suicidality is mental health care and treatment, preferably psychotherapy. There's some more claims. Here's another one. Puberty blockers for gender transition are simply a pause and are fully irreversible. False information. Over 95% of all youth treated with puberty blockers proceed to cross-sex hormones. Puberty blockers have significant side effects, including compromised harm to bone development and bone density, the possibility of permanently altering the developing brain and possibly affecting other vital organs. We have no long-term studies on the health of these children after transitioning medically. We need to go back to do no harm. When in doubt with any medical procedure, parents must be provided with the most current information based on the best studies and the best practices, with the expectation that the child will not be harmed unnecessarily. Gender affirming care is harming our children unnecessarily and causing irreversible damage. We need to stop this kind of care right now. Thank you for listening.